Hello and welcome. Hyperacusis, often mistaken for tinnitus, a complete overview of this video and help. You see, the video is to look at hyperacusis. Now, I've looked at other videos on this condition and I believe this will be the most comprehensive one available. So, the video will look at how prevalent it is, the connection between hyperacusis and tinnitus, the impact hyperacusis can have on someone, the causes, the etiologies, or in plain English, the studies of, potential mechanisms and treatment options. Now, there's quite a bit to go through. Now, to make it easy to understand, I will use the full transcript to go with my dialogue. I'll also include a glossary of the terms in the description if you're not familiar with some of the medical terms, because they can be sometimes quite challenging to follow if you don't actually know. Now, when it comes to treatments, I have some really helpful info in this video for you, especially if you're suffering with hyperacusis. Now, I will also say it's important if you suffer with the condition, then don't delay in seeing a medical professional. So before we do get into the video, I just have to say that this is for information purposes only. I am not a doctor, a chiropractor, or an audiologist. They all give their names as doctors, but no, I'm not a medical doctor. I work in the natural therapies side of medicine and treatment. So let's get on with the video. I think you'll find it useful. Okay, so what is hyperacusis? It's a disorder of loudness perception, characterized by an unusual sensitivity to ordinary environmental sounds. It's defined, or should I say it's defined, as a constantly exaggerated or inappropriate response to sounds that are not threatening or uncomfortably loud to a typical person. Unlike phonophobia or misophonia, which are specific to certain sounds, hyperacusis is associated with sounds in general. Phonophobia tends to be used specifically for the loudness intolerance reported by some patients with migraine. Now, hyperacusis can be distinguished from loudness recruitment, which is a phenomenon commonly associated with cochlear hearing loss and specifically with dysfunction of the outer hair cells of the organ of corti. Now, with loudness recruitment, the perceived loudness increases faster than normal, with a rise in sound level. However, loudness recruitment does not vary with mood, unlike hyperacusis. The mechanisms and approaches to treatment of hyperacusis is still an under-researched area. Now, don't worry about, as I say, some of the words that are used, and I have to use the words that are there for this medically. So I will put a glossary of terms in the description to hopefully help you along the way. So let's press on. And the prevalence, you see, the prevalence, incidence and quantification of a disability related to hyperacusis is not really well understood due to a lack of data. Really, a study by Fabijanska et al. In Poland found that 15.2% of 10,349 respondents reported hyperacusis, with a higher prevalence in females than males, and regional differences. Now, this is quite interesting. With tinnitus, there is more males than females. However, the study had a lack of specificity to it. So more recently, Anderson and colleagues conducted a study in Sweden using both the internet and postal methods to investigate the prevalence of hyperacusis in the adult population. Now, they found a point prevalence of 9% in the internet study group and 8% in the postal study group, which is pretty close, obviously. So, however, it should be noted that participants were not asked if they had ever sought a medical opinion regarding their hyperacusis, and there is no reported data on incidence of hyperacusis. So this suggests that more research is needed to fully understand the prevalence, incidence and quantification of the disability itself, all related to hyperacusis. So moving on, where there has been some more research, and I'm a big believer that there is a massive link between tinnitus and hyperacusis. So you see, the correlation between tinnitus and hyperacusis is well established, with many patients experiencing both conditions simultaneously. Studies have shown that among patients who visit tinnitus clinics with a primary complaint of tinnitus, the prevalence of hyperacusis is around 40%. Bear in mind that figure, 40%. On the other hand, patients who have a primary complaint of hyperacusis, the prevalence of tinnitus is reported as 86%. Now, these findings suggest a strong connection between the two conditions and have led to speculation about potential common underlying mechanisms. Now, it's worth noting that tinnitus and hyperacusis are closely related auditory disorders and that both can have a significant impact on the quality of life. So, they are closely related in terms of their causes, symptoms and risk factors. Therefore, it's not surprising that they often occur together. Now, as a former sufferer of tinnitus, and this is the other thing, hyperacusis isn't so well known, I fully understand or fully believe that I was also suffering from this as well. More on that later and in other videos, but let's have a look now at the impact of hyperacusis. So you see, to measure the impact of hyperacusis on an individual's quality of life has been a challenge, but in recent years, two instruments have been developed to quantify the disability associated with hyperacusis. The Calaf et al. Developed a self-report hyperacusis questionnaire, which consisted of 14 items on there, 14 questions, which was normalised based on responses from 201 individuals who answered a recruitment advertisement. Now, the results of the questionnaire that they received revealed that three factors accounted for 48% of the variance: attentional, social and emotional. Similarly, in other research, Nelson et al. Developed a 27-item questionnaire, which was examined in 226 patients with hyperacusis. Now, the results of this questionnaire show that 51% of the variance was accounted for by cognitive reactions, actional somatic behaviour and emotional factors. However, it's worth noting that the questionnaire is currently only available in German, and neither of these instruments have been shown to be sensitive to treatment effects. Now, despite this, these instruments are a step forward in the understanding and the impact of hyperacusis on an individual's quality of life, because this is really what it's all about, the quality of life that we have with any condition. So, what are the causes of hyperacusis? Now, the causes of hyperacusis in the majority of cases are unknown. However, some underlying medical conditions have been identified as potential causes. There's two, Katzenell and Segal, reviewed the conditions in which hyperacusis has been reported as a symptom, and they are listed in further down below. It's worth noting that several of the peripheral conditions identified involve facial nerve dysfunction. Now, this may reduce the efficacy of the stapedial reflex, a mechanism for reducing the perceived intensity of impulse sound, thus increasing the perceived intensity of sound itself. Now, this does not meet the strict definition of hyperacusis. The etiologies, in summary, the etiologies of hyperacusis are not well understood, but some underlying medical conditions have been identified as potential causes. However, the majority of cases have no underlying medical condition that can actually be found. So, further research is needed to fully understand the causes of this disorder. You see, hyperacusis is a disorder of loudness perception that can be associated with both peripheral and central medical conditions. You see, some examples of peripheral conditions include Bell's palsy, Ramsay-Hunt syndrome, stapedectomy, perilymph fistula, and Lyme disease. Central conditions associated with hyperacusis include migraine, depression, post-traumatic stress disorder, head injury, and Williams syndrome. So let's have a look at some of these. Now, Lyme disease, which is a tick-borne infection caused by I won't even try to pronounce the name of it, with them little devils that you get. Okay, my dog gets them as well all the time in her. So these can actually target specific body organs, including the peripheral and central nervous system. Now, it's worth noting that facial palsy can be a feature of Lyme disease, leading to stapedial reflux dysfunction, which can cause an increase in perceived intensity of sound. And so there's the link. However, there are also reports of hyperacusis in Lyme disease without facial nerve dysfunction. Williams syndrome. Williams syndrome is a genetic disorder characterized by deficits in conceptual reasoning, problem solving, motor control, arithmetic ability, and spatial cognition. Now, it has an incidence of 1 in 20,000 live births, and up to 90% of individuals with this syndrome report hyperacusis. A proposed mechanism is 5-hydroxytryptamine, or easy to say 5-HT dysfunction. Okay, other conditions with hyperacusis have been reported include middle cerebral aneurysm, migrainous cerebral infarction, and multiple sclerosis. Now, it's worth noting that most cases of hyperacusis do not reflect an underlying medical disorder, but a medical assessment is still desirable. Potential mechanisms. Hyperacusis has several potential mechanisms, and it's likely that the patient population is heterogeneous, the same root causes, similar to tinnitus. The high prevalence of hyperacusis in Williams syndrome led research to consider the mechanism in that condition and how it might be generalized to other individuals. One proposed mechanism is the involvement of 5-HT, which is a neurotransmitter that plays a role in modulating auditory gain and the determination of sound significance. However, there is no evidence that 5-HT disturbance contributes to non-syndromic types of hyperacusis. Additionally, even in Williams syndrome, the excessive auditory gain may be partly explained by the high incidence of otitis media with effusion and associated conductive hearing loss. Another proposed mechanism is the observation that hyperacusis and tinnitus appear to increase in intensity during times of tiredness, anxiety, or stress. Researchers have hypothesized that during stress, endogenous endorphins are released into the synaptic region beneath inner hair cells, which might potentiate the neurotransmitter glutamate, causing sound to be perceived as excessively loud. Now, this model applies to both externally generated and internally generated tinnitus sound, but there is not yet empirical evidence to support it. Another potential mechanism of hyperacusis is auditory efferent dysfunction. The auditory efferent system is present in all mammals and in humans. It consists of both a lateral and medial system. The function of the lateral system is not well understood, but it originates around the lateral superior olive and terminates on the primary afferent dendrite beneath the inner hair cell. Now, the medial system begins medially with the superior olivary complex and terminates on the base of outer hair cells. And its functions include modulation of auditory gain and the behavioural response to sound. The medial auditory dysfunction might contribute to both hyperacusis and tinnitus. Disturbance in ability to modulate central gain might result in persistent sensitivity despite exposure to noise of moderate to high intensity. However, there is evidence against any such role, as patients who have undergone vestibular nerve section, usually for symptoms of vertigo, refractory to other treatments, do not complain of increased tinnitus or loudness intolerance. The psychoacoustic testing of such patients reveals no decrement in auditory performance. Patients with hyperacusis may experience anxiety and fear, which can be true for specific sounds or for sound in general. Now, the links between the central auditory system and the areas of the brain implicated in anxiety and fear are now under close scrutiny. Specifically, anatomical and functional links between the central auditory system and the amygdala have been identified, the amygdala being an essential element of fear conditioning. Such processes have been described as integral to the development of tinnitus-related distress and also to the fear and anxiety component of hyperacusis. In view of the evidence that the central auditory system has a role in setting auditory gain, the possibility of some central hyperexcitability should be considered. You see, researchers have discussed this as a potential mechanism for hyperacusis. The experience of hyperacusis in patients with no apparent dysfunction of involvement of the peripheral auditory apparatus is circumstantial evidence in favour of this mechanism. They also suggest that such hyperexcitability manifests as hyperacusis. So, what about treatment options? Hyperacusis is a condition in which, as I say, individuals experience an increased sensitivity to certain sounds. One common reaction is hyperacusis is to use earplugs or other devices to protect the ears from loud noises. However, this strategy actually may worsen the condition by increasing the central gain of the auditory system. So whatever you do, do not use these earplugs to try and reduce the sound. In the past, many patients did not have many options for treating hyperacusis, and it was not widely recognised as a legitimate symptom. So, one treatment option for hyperacusis is tinnitus retraining therapy, TRT. Now, this therapy was first introduced in 1993 for tinnitus, has been modified for use in treating hyperacusis. Now, the therapy involves a classification of the patient's tinnitus and hyperacusis state, followed by counselling about the auditory system and mechanisms of tinnitus and hyperacusis, as well as the distress associated with them both. Now, binaural sound therapy using ear-level wideband generators is also used in the treatment and is based on the concept of desensitization, gradually increasing the sound intensity over time. While there have been no randomized controlled trials done on retraining therapy for hyperacusis, observational studies have suggested improvements in loudness tolerance. However, concerns have been raised about the objectivity of the therapy due to the training required to perform TRT. Another treatment option for hyperacusis is cognitive behavioural therapy, CBT for short, which has been found to be effective in treating the psychological distress associated with tinnitus. Now, this therapy, along with the information counselling, relaxation therapy and sound therapy, may also be beneficial in treating the anxiety and stress associated with hyperacusis. However, there is currently no evidence to support the use of CBT in treating hyperacusis. Currently, there's some tension between the advocates of retraining therapy and the advocates of psychological therapy for hyperacusis. However, both therapies may have value and patients may benefit from the insights from both approaches. Okay, so really to conclude and summarise, I feel the findings are typical in some ways of the medical profession, where they're very vague and non-committal on their assessment. There's lots of options out there, but no one will say this will work or will not. Now, although I'm not a doctor or audiologist or chiropractor, as I mentioned, I've been a natural health therapist for over 20 years, and as a former sufferer of tinnitus, know how the effects can be on your well-being. Now, I truly do believe, after seeing lots of people over the years with various conditions, including hyperacusis, tinnitus, and many other conditions, that we as human beings can become our own worst enemy when it comes to our body and mind function. I may not have all the answers, but I feel without question that stress and increased stress we create through our condition, whatever that condition may be, is the route to alleviating the symptoms. I'm not saying your tinnitus or hyperacusis will stop, but if you can reduce the stress, the reduction of the effects can be dramatic, really can. So I think that's certainly something to look at. Now, as I said, I'm going to put some more information. It may not be on at this moment, but I am putting it together certainly for hyperacusis because it isn't something that's really talked about that much. But I reckon any of you that have tinnitus will suddenly think, wait a minute, that really applies to me, because thinking back when I really was bad with my tinnitus, the hyperacusis side, which wasn't even known, I'd never heard of it then, was definitely a part of what I was suffering with. So on that note, I'd like to wish you all good health, take care, and we'll see you in the next video. And have a look on the channel for the other videos, because I'll be doing some more on hyperacusis and also tinnitus, which are very, as we've seen, very closely linked. Okay, take care, bye-bye now. Of its lack of because of its lack of specificity. However, the study had a weakness. However, the study had a weakness to it due to its lack of specificity. Due to its 5-hydroxytryptamine. 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 Otitis.